Hey everyone, my name's Caleb, as you all know. Today I will be discussing brain tumors as my pathology. The reason why I chose this pathology is because, or at least one of the main reasons, is because in 2012 my grandfather actually passed away from a brain tumor. So this pathology really hits home to me. It also is just a really interesting pathology, uh, in my opinion. So, some objectives we'll be going over today are describing or defining what a brain tumor is, uh, what are some things that can cause them, why it's important for uh, us as imaging technologists, and how it pertains to our job. uh, the primary and secondary modalities I chose for this project, as well as going over the images and how to treat uh, brain tumors, as well as patient prognosis and care. Now, simple place to start would be asking the question, what is a tumor? Tumors are a form of abnormal cell growth within the body. When referring to tumors, there are two different types, and these types are benign and malignant. Benign is a term that refers to a tumor not being cancerous. Malignant means that they are cancerous. Now, the reason why I put location in here is mainly to segue into the fourth part, uh, because location, as you all know, just refers to where the tumor is inside the body. Uh, the reason why I bring up location is because of this fourth point, metastatic versus non-metastatic. Metastatic means that the tumor originated elsewhere in the body and moved to the location that the tumor was found. And non-metastatic means that the tumor originated where it was first discovered. Some causations uh, are genetic and environmental. Um, some of the hereditary risks that can cause brain tumors are Lynch syndrome, which is a form of colorectal cancer, or tuberous sclerosis. This is a condition that may cause benign tumors to appear in different parts of the body. Uh, Both of these reference back to my previous slide in this being two different ways that uh, tumors can metastasize. An example of environmental cause of brain tumors is malignant melanoma metastasizing to the brain. And this is a type of malignant tumor that you can get from skin cancer. It's when you tan a little too long in the sun, you know. Now, what is our role when it comes to this pathology as imaging technologists? This is important because when finding that a patient has a brain tumor, you know, you don't want to go just digging around in people's heads, that can be really dangerous. So obviously, we use imaging as a way of diagnosis, and through this diagnosis, you can evaluate how bad the situation is, or where the patient is as far as different stages, and then when you determine that, you can then proceed to planning for a treatment. Now, the primary modality that I used was MRI. This is the main form of imaging when it pertains to this specific pathology. The second modality that I use for this pathology is CT. This is still a great way of determining whether a patient has a brain tumor. However, it's not as detailed as MRI. Now, these are the MRI images that I was able to obtain. On the left, the first image is a sagittal view of the brain. The lower right portion of the brain is displayed, and this shows the medulla oblongata. Thank you, the water boy, Adam Sandler. In the center of the medulla oblongata, you'll see a really dark portion. That is the tumor. It's also known as a medulloblastoma. In the center, the second image, in the lower midsection of the brain, this is a coronal view. You will see the tumor in full profile there as well. And in the third image, this is a axial view of the brain, with the tumor being the lighter circle towards the lower portion of the brain in the center as well. Now, this is an axial view of a CT scan of the brain, and it shows the medulloblastoma in the mid lower portion of the image. Some treatments for this specific pathology is obviously surgery. This is typically not something that you want to do when referencing the brain. It's really invasive. Typically, it's radiation therapy that is the first primary way of dealing with this, and that is essentially targeting that tumor with radiation from multiple different angles to essentially destroy the tumor. The prognosis for people with brain tumors is calculated in a 5-year relative survival rate. Ages younger than 15 have a 75% survival rate. Ages 15 through 39 have a 72% survival rate. And ages 40 and older have a 21% survival rate. And here are my references. Thank you.